Hi, I'm Carolyn McClanahan. This is a continuing series on the crazy world of healthcare reform. I've done 4 videos so far. The first was on the history of healthcare reform, the second on the cost of healthcare, the third on the Affordable Care Act and what happened to it, the fourth on the American Health Care Act and other Republican proposals, and now we're going to move into what I call what we need out of healthcare reform. So let's get started. First, what do people want? Are we really focusing on the right problem with healthcare reform? There's so much we can do. The politicians have historically focused on how we pay for healthcare. And what we need to focus on is how do we fix healthcare? So that is the problem. So fixing the system will lower cost. We can move to something like a single billing system that would save a lot of money. Get rid of fee-for-service and move to paying based on what kind of care we deliver instead of how much care we deliver. We can move to one nationalized electronic medical record. Right now, we have so many different types of electronic medical records that are built around billing, not around good patient care, and it fragments our health care and makes our health care actually more dangerous, and it makes practicing medicine unenjoyable. So we need to fix our electronic medical records and move to one nationalized electronic medical record. Then another thing we could do is move from 4 healthcare systems to one healthcare system. As I discussed in a prior video, we have government paid and government provided, which is the armed services and the VA. We have government paid and privately provided, which is Medicare and some of Medicaid. We have privately paid, privately provided, which is individual insurance, and then finally we have the self-insured. So we need to decide which healthcare system do we want, because having all 4 makes it very inefficient and very expensive. And the last one, and the one that I really like the idea of, is let's remove primary care from insurance. Let's talk a little bit about how insurance works. Insurance is meant to cover high cost or rare events. Things like hypertension, diabetes, obesity, common colds, back strains. Those are not rare events and they're not high cost. Insurance companies have overhead of about 25%. So allowing insurance companies to be the middleman in paying for primary care transactions just makes it way more expensive. So if we removed primary care from insurance and paid for primary care directly, which I'll talk about in a bit, we could greatly reduce the cost of health insurance for the high cost and catastrophic events. So what else can we do? Can we decrease complexity and overhead? That's the biggest problem with our system. It's very complex, which adds to overhead, and it adds that they don't even count how much it reduces our productivity. I mean, so many of us spend hours on the phone trying to make appointments, get our billing straight, dealing with pharmacies. It's crazy how much we lose in productivity because our healthcare system is not efficient. So that's not even included in the cost. Right now, we spend 25 to 30% in overhead. Other countries' overhead is 5 to 15%. If we could cut overhead to 15%, that would save us anywhere from $320 to $400 billion per year. That's enough to provide basic primary care, dental care, and mental health care to everybody in this country for free yearly. So we've got to do something about that overhead. So let's talk about things we can do. Why wouldn't we create a free base of primary care for the entire country? Right now, community health centers provide primary care, mental health care, and dental care to their patients for, on average, less than $1,000 per person per year. This is all the basics, so it's not fancy care, but it's what most people need. 75% of the population only needs primary care type of doctors. They don't need specialists. And so we could take care of most of the population's needs through things such as community health centers. So we could also provide the basics of all the prevention. Keep our population healthy and productive. So if you have a roofer who doesn't have health insurance that needs to get basically a tooth fixed, or they hurt their back, to be able to just go to a community health center would be so much better than what they have access to today. The other nice side effect of creating a network of free community health centers throughout the country is they can serve as an epidemic preparedness center. Right now, we're at risk for epidemics. So if you've heard of bird flu in the past, Ebola, we are not prepared for major epidemics. They could also be used to combat the opioid crisis because we could put programs throughout all the community health centers to do this. And it would prepare us for bioterrorist events, things such as anthrax. And so we're not ready for these, and we need a nationwide network of community health centers to prepare for this. With community health centers, right now, they're basically set up to take care of the poor population. And so right now they take care of about 25 million people. They have structural capacity to take care of many more. And we could easily expand community health centers to take care of all 323 million people in this country. Now the nice thing is if people don't want to go to a community health center, they can pay for primary care directly out of pocket. And so they can go to what's called direct primary care providers. So if we do this, we can remove primary care from insurance coverage, and that would make insurance much cheaper. Now, what do we do about insurance? So after we fix the basics of the system, rebuilding primary care, providing primary care free to everybody, then we can decide how are we going to pay for coverage. And ideally, I think we need a public and private option for care. So a lot of people are talking about Medicare for all, but there's some problems with Medicare for all. Medicare for all needs some competition too. Private insurers need competition. So having public and private options to buy insurance would keep both types of entities functioning at their best. So how much would it cost to provide basic primary care, mental health care, and dental care to everybody? We would have upfront infrastructure costs. We'd need to create these centers. Think of it as creating a center that provides the basic care, very standardized in what it would be delivering all throughout the country. So it's sort of like a chain restaurant, and think of a good chain that you like. Wouldn't be quite a Starbucks, but it could go along those lines, or a Chipotle's or whatever. We can create a standard type of program that would be very inexpensive. We could replace the post offices with all these community health centers. The ongoing cost would be about $300 billion per year. And that's probably on the high side because some people may not want to go to community health centers. They can pay out of pocket directly to go to direct primary care providers, but they always have the option to go to a community health center. So remember, how much do we waste in overhead? It's about $320 billion to $400 billion a year. We could easily afford this by making our system more efficient. And there are many other ways to pay for it. So I wrote an article. I'm a regular contributor to Forbes.com and to Financial Planning Magazine. So I've included the link of my article to Forbes that better explains this approach. And upcoming November 13th of 2017, so we're hoping to get this up in the next day, so you have a week to think about it, is I'm participating in a panel on pros and cons of Medicare for All through the Economists for Peace and Security Forum in Washington, D.C., and I will discuss my plan a little bit more there as we debate the Medicare for All pros and cons. If you want more resources about healthcare and healthcare reform, 3 books I highly recommend. An American Sickness by Elizabeth Rosenthal. She goes through all the different ways that the system just takes advantage of society. So how hospitals, doctors, pharmaceutical companies, how they all do things that we need to stop. We need to take control of the healthcare system. The Heart of Power by Blumenthal goes through the history of healthcare reform. It's a very fascinating book when you learn the motivations behind each of our presidents and why they did what they did with healthcare. And finally, The Healing of America from T.R. Reid. This is an older book, but very good still. He traveled the world experiencing different healthcare systems to compare them to ours, and he found some very fascinating things. So for now, that's the end of my series on healthcare reform. As things change, I'll put more up. And if you have any questions, comments, or more topics you'd like me to delve into deeper, please let me know, and we'll consider making a video for you. Thanks so much.